Good afternoon. My name is Autumn Mason. I'm a nurse practitioner student, and I am here with Lisa, who has agreed to be our patient today. She's going to be helping me with a full head-to-toe assessment. As with any assessment, we always start by washing our hands, which I did before I came into the room. And the next step is to check Lisa's vital signs, which were taken before I came in. Her temperature, blood pressure, heart rate, respiratory rate, oxygen saturation, height, weight, and BMI are all normal and in alignment with her baseline. So next, I'm just going to do a general assessment. Take a look at Lisa. I see that she is well nourished, well groomed, and in no apparent distress. So next, I will move on to an assessment of her skin. I'm going to start by checking the temperature of Lisa's skin using the back of my hand because it's more sensitive than the palm. And I can feel that Lisa's skin is warm and dry. I don't see any rashes, lesions, any areas of redness, or any cuts, burns, bruises, anything like that. So next I'll move on to an assessment of her fingernails. When I'm looking at Lisa's fingernails, I'm looking to see if there are any ridges, cracks, cyanosis, or clubbing, none of which I see. So I'll move on to an assessment of her hair and scalp. What I'm looking for here is even distribution of the hair, even texture, no bald spots. I'm looking to make sure that her scalp is intact, that there are no lesions or areas of tenderness, and that of course there are no parasites in her hair, and all of that looks great. This is also a good opportunity to palpate the skull. I'm checking for symmetry, any areas of pain or tenderness, and any bony deformities, none of which I feel. So we'll move back around to the front and take a look at Lisa's facial features. I see that they're well placed and symmetrical, that her palpebral fissures are symmetrical, that there's no drooping or edema on one side of her face or the other. Next, I'll have you swing your feet over towards me, Lisa. We'll check some of your cranial nerves. I'm going to have you stick your tongue out, then move it to the side. Other side. Good. Show me a big smile. Good. And puff out your cheeks. Great. Next, I'm going to palpate your sinuses. I'm going to start with your frontal sinuses here. Tell me if there's any tenderness there. Good. And we'll do the maxillary sinuses. No tenderness there. I'll palpate Lisa's temporal arteries, both of which are palpable. Okay. And next, I'll move on to an assessment of her eyes. I'm going to start by checking her sclera and conjunctiva. I'm looking for any redness, drainage, tearing, lesions, lumps, bumps. Everything looks good. Next, I'll check your pupil's reaction to light. Look forward for me. I'm going to shine a bright light in your eyes here. Good. Now follow my pen light as I bring it closer to you. Great. Next, I'll check your extraocular movements. Keep following my pen light as I move it up and down, out to the sides, and way up into the corners here. Good. All right. Next, I'll check your peripheral vision. I want you to close one eye for me, and then let me know when you can see my fingers wiggling in your field of vision. Okay, how about over here? And over here.
I see him.
Now close your opposite eye, same thing.
I see him. I see him. I see him.
Good. This would be a good opportunity in our exam to use the ophthalmoscope to take a look at Lisa's optic disc, her vessels, and her retina, but that equipment isn't available to us today, so instead we'll move on to an examination of her ears. I'll start by just inspecting Lisa's external ear. I'm looking for symmetry of the pinna, any redness, swelling, drainage, discharge, none of which I see. And similar to the eye exam, this would be a great opportunity to use the otoscope to take a look at Lisa's eardrum to make sure it's pearly, that there are landmarks visible, and no evidence of fluid buildup or infection behind the drum. Because we don't have that equipment, we will instead move on to a hearing test. The first test I'll do is called the Weaver test. For this, I'm going to strike the tuning fork against my hand and then place it directly into the middle of your head. And then I want you to tell me if you hear the sound equally in both ears or greater in one ear or the other. Okay.
Hear it equally in both ears.
Perfect. The next hearing test we'll do is called the Rennie test. It's similar, but this time I'm going to place the tuning fork on the bony prominence behind your ear. I want you to tell me when you can no longer hear the sound, and then I'll move it to the front of your ear, and the same thing, you'll tell me when you no longer hear the sound.
Okay. I no longer hear the sound. I hear it.
Perfect. The next test I'll do is the whisper test. I'm going to stand about a foot behind you, and I'm going to whisper a series of 3 numbers and letters, and I want you to repeat those back to me.
Okay. A for 1.
Perfect. Same thing over here.
2B3.
Great. So it seems like Lisa's hearing is intact. So next we'll move on to a quick examination of her nose. And just by looking at Lisa head on, I can see that her nose is symmetrical, that she doesn't have any bleeding, drainage, or discharge. But I will use my pen light here to take a quick look at Lisa's nasal mucosa. It is pink, moist, and intact. I see her terminates, there are no polyps, and her septum is midline. So next, while I have my pen light handy, I'll take a quick look inside Lisa's mouth. Have you open real big for me. I'm looking to see that her tongue, oral, and buccal mucosa are pink and moist with no lesions, and they are. Have you stick your tongue out for me and say, ah. Good. I'm checking to see that her palate rises symmetrically, that her uvula is midline. You can put your tongue back in. And if Lisa had not had a tonsillectomy, I would also be checking to see that her tonsils were intact with no swelling or drainage. I can also use this as an opportunity to take a look at Lisa's teeth. Make sure that she has good dentition, no dental abscesses or caries, and all of that looks great. You can also check the gag reflex, but that's not a very nice test to do, so we'll go ahead and skip that for this assessment. And instead we'll move on to an assessment of Lisa's neck. I'm going to start by palpating your lymph nodes. You do have some right here in the back of your head, so I'm going to start there. And then just move down to these posterior cervical. All the way down into the collarbones. I'm feeling for any lymph nodes that are firm, tender, or non-mobile. And I don't feel any there. I can also see that Lisa's trachea is midline. It doesn't deviate one way or another. So I'm going to go ahead and move around to the back and I'll palpate Lisa's thyroid. Try to swallow for me. Good. I can feel both lobes of her thyroid moving up symmetrically, and I don't feel any nodes. So next, I'll check her cervical spine. I'm just palpating lightly to make sure that all of her vertebrae are in alignment, that none jut out, and that there's no tenderness here. This is also a good time to check the range of motion of the neck. So I'm going to have Lisa look down to the floor, up to the ceiling. Try to put your ear on your shoulder. Same thing on the opposite side. Good. And I'll do a quick palpation of her musculature here in her neck and shoulders. Make sure that the muscles are symmetrical and that there's no tenderness. Good. So now that we have assessed Lisa's head, eyes, ears, nose, throat, mouth, we're going to move on to an assessment of her lungs. We'll start with just a visual inspection. And looking at Lisa, I can see that she does not have labored breathing. There are no retractions, there's no use of accessory muscles, and the anterior posterior diameter of her chest is less than the lateral diameter. Now normally when you listen to the lungs, you'd want the stethoscope to be against bare skin, but because we'll be sharing this video with the class, we're going to let Lisa keep her shirt down and we'll listen through her tank top. Start by auscultating the anterior lung fields. Take a big breath for me. And again. I can also take a listen on the side here. Big breath. Good. And then move around to the posterior lung fields. Take a big breath for me. And again. One more. Good. Lisa's lung fields all sound clear. but there are a couple different auscultation techniques I can use to assess for consolidation in her lungs. The first is called egophony. For this test, I'll have Lisa say the letter E every time she feels my stethoscope against her chest.
E, 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 E.
Good. This next test is similar. It's called bronchophony. This time I'm going to have Lisa say the word 99.
99, 99, 99, 99, 99, 99.
Good. I'm going to do the same thing for this test. It's called whispered pectoriloquy, but this time you need to whisper the word 99. Good. I didn't hear any of those sounds particularly distinctly, which is good. That means there's no consolidation in Lisa's lungs. We can also check for consolidation with percussion and palpation. We'll start with percussion. With this test, we're just listening for sounds of dullness rather than resonance over the lung fields. Everything sounded nice and resonant. Next, we can check for tactile fremitus. For this test, Lisa's going to say the word 99 again, but instead of listening, this time I'm going to feel. Go ahead.
99,
And again.
99,
And again.
99,
And again.
99,
And again.
99,
One more time.
99.
Good. While I'm here behind Lisa, this is a good opportunity to check for costovertebral tenderness. So Lisa, you're going to feel me tapping on you and you let me know if you feel any pain. Good. I'm going to move around to the front again. If needed, I could do percussion over the anterior lung fields, again checking for any abnormal dullness rather than resonance, but Lisa's lungs sound great. So instead, we'll move on to the cardiac assessment. And similar to the lung assessment, normally you would have the patient remove their shirt, so you could inspect the chest, looking for any heaves or abnormal pulsations. We can also palpate the point of maximal impulse, which is normally right here in the fifth intercostal space. But we'll go ahead and move on to listening to Lisa's cardiac sounds. I'm going to listen with both the diaphragm and the bell. And while I have my bell ready, this is a good opportunity to listen for carotid bruits. Good. There is a distinct and audible S1 and S2 with no adventitious sounds, nothing that would indicate stenosis or regurgitation. So we'll move on to the abdominal assessment. And for this, I'm going to have you go ahead and lay down and make yourself comfortable here. Good. While your patient is supine, this is a good opportunity to look for JVD or jugular venous distension. This is best done with the patient lying with their head at a 30-degree angle. If I were to assess for this, I would shine my pen light at an angle up here on Lisa's neck. I don't see any pulsations, but if I did, I would measure the height of those. Since Lisa does not have any JVD, we're going to go ahead and move on to the abdominal assessment. Is it okay if I lift your shirt a little bit? Sure. All right. So for the abdominal assessment, we always start with inspection. So looking at Lisa's abdomen, I don't see any distension. There are no bruises, no masses, no abnormal pulsations. So we'll go ahead and move on to auscultation. I want to listen for vowel tones in at least 4 quadrants. Lisa has good active vowel tones. While I have my stethoscope handy, I'm going to turn it to the bell, and I'm going to listen for bruits over her major abdominal vessels, which includes the aorta, the iliac, and the renal arteries. There are no audible bruits, so I'm going to move on to percussion. Similar to our lung assessment, when I'm percussing Lisa's abdomen, I'm listening for any areas of abnormal dullness. I don't hear any dullness in areas I wouldn't expect it. This is a good opportunity to percuss the span of the liver. So to do that, I'm going to start well below the umbilicus in the right lower quadrant and percuss upwards until I hear the note switch to dull. And then do the same thing in the mid-clavicular line moving downward until I have a good idea of the size of her liver. And Lisa's liver is not enlarged, so we're going to move on to palpation. We start with light palpation, feeling for any masses or areas of increased tenderness. And then we move on to deep palpation. And everything feels good. If I had any concerns that Lisa may have appendicitis, there are a few special techniques that I can do to elicit those assessment findings. The first is to palpate in McBurney's point, which is in the right lower quadrant of the abdomen here. If I were to palpate deeply in this area and Lisa's appendix were inflamed, she would feel quite a bit of pain right there. I could also do Rosving's sign, which is palpation in the left lower quadrant. And if Lisa had appendicitis, she may feel referred pain into the right lower quadrant. Another sign to check for an inflamed appendix is the psoas sign. And for this, I hold my palm above Lisa's right knee and then have her lift her leg to meet my hand. And if Lisa had appendicitis, she may feel referred pain into her right lower quadrant with that maneuver. So I'm pretty confident she does not have appendicitis, so we'll go ahead and pull her shirt down. While you're supine though, this is a great opportunity to assess the joints of your lower extremities. So I'm going to start with palpation up here at your hips. I'm just feeling the joints, making sure they're symmetrical, that one isn't swollen, and that there are no areas of increased warmth or tenderness. Moving all the way down the legs and palpating the large muscles of the thighs. And then moving down here to the knees where the femur meets the tibia. I'm checking for crepitus, swelling, warmth, or pain, including over the patella. Moving down the lower legs and into the ankles. All the way down to each of the little joints of the toes here. This also gives me a good opportunity to take a closer look at Lisa's skin up close and make sure that she doesn't have any lower extremity edema or venous stasis, none of which I see. So we'll go on to check Lisa's range of motion, starting with the hips. You're going to start by having you bend your knee and then bring that knee up to your chest if you can. Good, and straighten it out. We'll do the same thing on the opposite side. Bring that knee up to your chest. Good, and straighten it out. Next, I'm going to have you bring your leg over the edge of the examining table and try to flex it backwards for me. Good, and back up. Same thing on this side. Good. And that test is great because Lisa has to bring her leg away from the midline and then back in, so I'm also checking for adduction and abduction. And next we'll check for internal and external rotation. So I'll have you bend your knee again, and then bring your knee across the midline there, and then away and toward the wall. Perfect. Do the same thing here, across the midline, and away. Good. Another great thing about that test is that I've also checked flexion and extension of the knee while we're checking the range of motion of her hips. So next we'll move on to her ankles. I'll have you pull your toes towards your nose for me, and then push down like on a gas pedal. Good. Point your feet out, bring them back in, flare those toes, and then curl your toes in. Good. I can also check Lisa's lower extremity pulses here. And I can feel that her dorsalis pedis pulses are equal and that her posterior tibial pulses are equal. While she's supine, I could also check her femoral pulses, but we'll let her keep her shorts pulled up. I'm pretty confident that she has good perfusion in her lower extremities. So instead, I'll help Lisa sit up, and we'll check the joints of her upper extremities now. And just like before, I'm going to start with palpation. I'm going to start up here by your shoulders, starting with the clavicle, moving all the way out to the bony prominence of the shoulder, feeling for any crepitus, swelling, warmth, or tenderness. all the way around the back here to the scapula. We'll check the muscles of the upper arms. And then the elbow joints here. Down the forearms. Into the wrists. And again, down to each joint in the finger. Good. I can check Lisa's radial and her ulnar pulses while I'm here. Good. And next we'll check her range of motion in her upper joints. We'll start with the shoulders. I'm gonna have you hold your arm out straight, then lift it all the way up, all the way down and back. Good. And then all the way out to the side and across the midline. Good, we'll let you relax that arm. Come over to this side and do the same thing here. All the way up, down and back, out to the side here, and all the way across. Good. Next we'll check your elbows. Flex your arms in for me, and then straight out. Good. Palms up like you're holding a couple of bowls of soup, and then down to the ground. Good. Make a fist for me. Now splay those fingers out. Try to keep your fingers splayed as I put a little resistance against them. Good. And can you give my fingers a little grip? Give me a good squeeze. I'm making sure that her muscle strength is symmetrical equally, which it is. All right, so next we will move on to checking Lisa's reflexes. We'll start with the reflexes in your arms here. We'll check your brachial reflex, which is right here. And have you flex your arm just a little and relax. Give it a quick tap. One more time there. Good, saw a little twitch of the fingers. And same thing on this side. Little tap. Good. Next we'll move down to the brachioradialis reflex, which is down here in the wrist. Good, little twitch there. Good. We'll do the triceps reflex next. This one's on the posterior arm. Relax your arm in my hand and just let it go limp. Quick little tap. Good, side twitch of the wrist there. Same thing on this side. Relax that arm in my hand. Little tap. Very good. We move down to the patellar reflexes, which are down here in the knee. This stool isn't quite tall enough, but we'll do what we can. We'll give a little tap here. Ooh, that's pretty good. And same thing on this side. Good. And last but not least, we'll check the Achilles reflex. Go ahead and relax your foot in my hand. We'll give you a little tap. Good, I saw a little twitch of the toe there. Same thing on this side. Good. So now we'll move on to the assessment of Lisa's nervous system. I'm going to check her sense of light touch here. Go ahead and close your eyes and tell me if you feel me touching you on the left or the right side.
Right. Left. Left. Right. Right. Left. Left.
Right. And I'm going to check up here too.
Left. Right.
Good. Keep your eyes closed for me. This next test I'm going to do is called graphesthesia. Will you put your palm up for me? I'm going to draw a number in the palm of your hand, and I want you to tell me what number it is. 2. Perfect. Keep your eyes closed. I'm going to put a common household object in your hand, and I want you to tell me what it is.
A key.
Good. That test is called stereogenesis. And next you can go ahead and open your eyes, and we will check your balance. So go ahead and stand for me. First thing I'm going to do is just watch you walk. So you can walk normally from one side and then back towards me. Good. And this time I want you to walk on your toes. Good. And this time on your heels. And back. And last one, I'll have you walk heel to toe for me. Good. This is another test to check for your balance. This is called the Romberg test. So if you stand here with your feet together and then close your eyes, I'm just gonna watch you stand for about 30 to 60 seconds. I'm looking for any swaying that may indicate that you have a balance problem. But you look nice and steady. So we'll just do a couple more tests here. I'll have you take a seat for me one more time. All right, this test is called flapjacks. I'm gonna have you pat your thighs with your palms and then again with the back of your hand. I want you to do that for me as quickly as you can. Good. And last but not least, I want you to touch my finger and then touch your nose. And do it again with the opposite hand. Great. So it looks like Lisa's nervous system and her range of motion are all intact. There are no abnormal assessment findings and she looks healthy. So we'll go ahead and let her go. Thank you.